My name is Dr. Harvey Abrams at Aaaah Wellness. That's 4 A's and an H. And today we're going to talk about leaky gut, detoxification, and weight loss. So a lot of people try weight loss procedures and practices for the first couple weeks, and they usually jump off the bandwagon within a short period of time. So we're going to talk about what it looks like to actually get your body in better shape through a weight loss practice that helps repair the gut and helps your body as you get older to be able to effectively lose that weight. So a lot of people have different reasons of why they would want to do something like this and why they would want to do a detoxification practice. And the reasons are people that have allergies, asthma, if you have problems with autoimmune conditions, people that have brain fog, you just don't feel right, people that want to lose weight, people with irritable bowel, acid reflux. There's a lot of digestive related problems of why people would want to do a detoxification protocol. And there's a lot of areas that you need to detoxify. So we're going to talk a little bit about what areas you need to detoxify. There are 4 basic rules to helping your body with detoxification. Number 1 would be to make sure you're giving up drinking alcohol and coffee. Number 2 would be to make sure that you're drinking plenty of alkaline water. That means at least half of your body weight should be drank in water, in ounces. So if you weigh 100 pounds, 50 ounces of water per day. And if you drink alkaline water, it's going to neutralize the acidity of your body, which helps push out those free radicals. Number 3, eat fermented foods. That means sauerkraut, pickles, things that are soured. Number 4, and by far I think the most important, trying to eat at least 51% of your diet with raw vegetables and raw fruits, which should be a 4-to-1 ratio. So 4 vegetables to 1 fruit. 51% raw, and try to buy as much organic as possible. There are 3 basic areas that help our body with detoxification, weight loss, and leaky gut. Of course, gut is one of them. The liver would be another one. And an area in the cell that produces glutathione would be the 3rd. So we want to discover what we need to do to help our liver detoxify, to help our gut stay healthy and improve all the different forms of bacteria in there. And we want to make sure that our cells are detoxifying. The gut is an amazing little system in itself. It's called an ecosystem. And the ecosystem has over 500 different species of bacteria. And with that, there's different bacteria that create what they call endotoxins. And these toxins will get into the wall of the intestines and they will cause them to open up. So a normal area of opening might be like this. And when you have a cell that tries to get through here, it can get through pretty easy. But when you have a larger molecule like a protein that is trying to get through and it can't get through, your body is stopping that for a reason. It's stopping it because it doesn't want you to get it all the way into the blood. If it gets into the blood, it creates a reaction, and that reaction is on your immune system, creating an inflammation. So when these larger molecules get into areas that have been opened up because of the toxins that are in your gut lining, they will impact you where it opens that cell up and causes them to leak through. And that's called leaky gut. When you have leaky gut, you have generally more susceptibility to inflammation, you have more acidity, and it's harder to detoxify. So it's important for part of the process of fixing and repairing the gut in the lining in order to detoxify correctly. If all you are doing is to detoxify your body in other areas like your lungs, your skin, your colon, then you're never ever gonna be able to get your body to detoxify as good as it can unless you fix these openings. So we have tools and ways of analyzing through lab tests to understand what's causing these problems in leaky gut. And there's a protein that breaks these linings apart that we test for now. And it's a very important test to understand what's causing these larger molecules to get into the blood that cause our bodies to react, that are creating neurological problems like migraines. They're creating heart disease by increasing what they call lipoproteins that get into the blood that affect our body for inflammation. So we want to work on repairing at the source. And it's a very, very important way of approaching not just fixing your gut, but your overall health. Another area of our body that needs to detoxify is our liver. So the liver is a large organ sitting on the right side, a little bit in the center, and it releases something called bile. And bile is like liquid gold. It actually is a very important part of our detoxifying process. It breaks down a lot of waste products that our bodies consume and our fat. So if you think about it this way, the bile helps regulate inflammation, cholesterol, and things that deal with thyroid function. So if you're trying to lose weight, if you're trying to increase energy, if you're trying to detoxify, the liver is a very important organ, and it's a core for working on trying to improve those functions, to help with weight loss, to help clean up the insides of our body. Our cells need to detoxify as well. So glutathione is in our cells, and it decreases as we age. So usually around age 18, our bodies start declining glutathione by at least 1% per year. So what would cause our glutathione to decrease? Of course, all the stress, all the toxins from our environment work on changing how our bodies can manufacture glutathione. So glutathione is very safe. It can be taken orally, but in a fat-soluble source. But one of the best ways to get glutathione is to get your body and your cells to manufacture it again. So if you work on improving your glutathione function, you work on your detoxification at the cell level. You work on detoxifying chemicals that are causing inflammation, making you sore and achy. It's very important to detoxify at the cell level, not just the liver, not just the skin, not just the colon.